Nice to meet you all.
Welcome, everybody. Thank you for joining us today. This is the STOP Administrators Clinic. This is our every 2-week time for STOP administrators and subgrantees and others to get together to learn from each other and from some experts. So we're welcoming you today. We've got people joining the Zoom room, so we're going to wait just a sec for everyone to fully get onboarded here or enter the room. And it looks like we're probably there. Let's give it one more minute just to see if we've got everyone in and we can start. So thank you everyone for joining. Just hang on for just a minute. Courtney, do we have anyone else waiting to get in?
No, that looks like everyone.
Okay, all right. Well, why don't we get started? We're right at 5:01. Hi, everybody. My name is Robin Hassler Thompson, and I am a consultant to also and the STAR project, which is the technical assistance project to all the STOP administrators around the country and in all of our territories. I'm here to welcome you again to another clinic. And what I'd like to do, as per usual, I always brief our speakers with this, so I feel like it's important for us to kind of introduce ourselves so they know who you are. And if you had any questions about the topic for the day, which I'm going to go over, then you can ask that question. So let me just tell you right away, we are kicking off here. We're starting observing Sexual Assault Awareness Month this April. And we're really honored to have two wonderful speakers with us today. What I'd like to do before introducing them proper is to ask our also team to say hi and to introduce themselves, and then we'll reach out to everybody else. So would you like to kick us off, Courtney?
Hi, my name is Courtney Kataskis, and I am the program coordinator with the STAR project.
Hey everyone, I'm Mary Seifman, the Director of Policy at the Also STAR Project.
Hi everybody, I'm Marisol Giroux, Event Manager at Also. Good to see you.
Great, great. Thank you, all of you. And let me introduce our two speakers. I'm going to ask them to hold speaking yet, but I would like to let you know that with us today, we have two wonderful people, Laura Palumbo, who's with the National Sexual Violence Resource Center. Laura is the communications director there. And we're grateful to have you, Laura. Welcome. And we also have Karen Galbraith. And Karen is also an expert in this field, of course. She's a training coordinator with PCAR, the Pennsylvania Coalition Against Rape. And when they begin their presentation, they'll give you a little bit more information about themselves and their work. But before we start with them, I'm going to ask them just to hold so that everyone else on the call can have an opportunity to introduce themselves and to let our speakers know if in particular, you know, when you saw that we're going to be talking about sexual assault and Sexual Assault Awareness Month, or SAAM, that you might have had some questions come up. You might want to talk about this issue. And also, because these clinics are available for you to speak about other things that are going on in your implementation planning process or anything else around your STOP grant administration issues, you know, we're here for you on that too. So, so let me start out and just ask you if you'd like to say hello and to see if you have any questions for our speakers today. Bill, I can see you on the Zoom screen because you've got your video on. So why don't we start with you?
Hi, everyone. Bill Schaefer with New York State. I'm the STOP and SASP administrator here. And I don't have any particular questions about the topic. I'm glad that we're celebrating Sexual Assault Awareness Month together. So I'm here to learn. Thanks.
Thank you, Bill. All right, who's next?
I'll go next. Laura Russell, the Grants Program Specialist for Rural SASP and VAWA in Oklahoma. and I don't have any specific questions.
All right, good to hear from you, Laura. Thank you. Were you about to come on, Lana?
I can if I can get unmuted.
Hit that mute button.
I'm Lana, and I'm from Kentucky, and I'm the SASP and the STOP coordinator. And I don't have any particular questions, but I'm glad we're doing it. We're still working remotely, and I kind of feel like it's missing something, all the normal stuff that's going on. So it'll be nice to hear some discussion about it today.
Great. And there's some great tools and things you're going to learn about for, that are going to be enhancing, I think, to what you can do this month and going forward as well. Emily, would you like to say hi?
Yeah, I can go next. So I'm Emily Line-Olmsted. I am the STOP coordinator for the state of Arizona. I work closely with our SASP coordinator, and I even sent her the invite. I'm not sure if she's on the call. Her name is Galen Davis. So we are celebrating Sexual Assault Awareness Month here in the state with a variety of different programming. And I previously was a sexual assault advocate when I was in direct practice in the state of Ohio. So I'm really looking forward to this conversation today.
Great, Emily. Thank you. And you're reminding me of that. It's more than an adage. I think it's a truth that we're all each other's teachers and we're all each other's students. So look forward to hearing from you during this process. Kaylee, would you like to step in?
Hi, my name's Kylie, also
Kylie.
from Arizona. I actually work with Emily. I'm the grant auditor for SASP and STOP.
Okay, great. Sorry about mispronouncing your name, Kylie.
Okay.
Welcome.
Thank you.
Okay. Dina?
Well,
Deanna?
I'm Deanna.
Deanna?
I'm actually from the North Dakota Department of Health, and I'm the STOP and SASP administrator, as well as some other state funds and some other injury prevention programs and other wellness programs as well. So our domestic violence rape crisis coordinator she did a governor's proclamation for Sexual Assault Awareness Month. So that was nice to have that done, and then doing a press release. So that's what's happening right now.
Okay, great. Thanks, Deanna. Tina, are you able to say hi? Yeah.
Yes. This is Tina Utley from Missouri. We administer the SASP, the VAWA grants, and the state grant.
Okay, great. And did you have any thoughts or questions around this this topic tonight?
I do not have any questions. I'm just here to learn more.
Thank you. Okay, great. And Joy, are you able to say hi? See if you have any questions.
I am Joy Jones, STOP and SASP administrator for the state of Mississippi with the Mississippi State Department of Health, and I do not have any questions.
Okay, great. Great to have you here again, Joy. Welcome. All right, so let me now turn it over to Laura and to Karen to start. And I don't know that we talked about this just as we were gathering before, but are you going to want to share your screen at any point with our participants today?
If it's all right, I was hoping to share my screen.
Okay, good. Courtney is forewarned and she can get ready for that. So that's very helpful. Well, let me thank you again, both of you, for doing this and for your time and your prep calls and all the prep work you did to be with us today. We really appreciate it. And let me turn it over first to you, Laura.
Sure.
All right, great.
All right. So thank you all for having us here today. As Robin has mentioned, my name is Laura Palumbo, and I am Communications Director at the National Sexual Violence Resource Center. And I've actually been on our team going on 11 years now. So this has been a long part of my career is working at NSVRC and specifically on our projects related to public education and awareness around sexual assault and sexual violence. And so Sexual Assault Awareness Month is one of my favorite projects that we do and that my team is heavily involved in as our communications department. As you can see, my Zoom background is decked out with my teal ribbon, which is one of the many freebies that we have for SAAM that people are welcome to access. And I'm excited to just explore with you all some of the materials that we have specific for Sexual Assault Awareness Month, but I also am going to try and give you all a good overview of the National Sexual Violence Resource Center's tools and materials, so that you you're aware of the resources and support that we can offer to your states and projects year round, because it's just wonderful to have this opportunity to connect. So in terms of my background, it's really been heavily influenced by working in the sexual violence field, from being, and pretty much from being an advocate in sort of a college campus situation to now having spent most of my career at the National Sexual Violence Resource Center. And my background is actually in communications and in media studies. And a lot of what is kind of unique around NSVRC's work is that we not only are working on public education, but also working with journalists and news media and how they cover the issue of sexual violence. And so one of my favorite parts of my role at NSVRC is working directly with journalists and media that are covering sexual violence and helping to inform their news coverage and to give them resources to support their work. And I'm going to start sharing my screen now so that I can show you NSVRC's website, which is that up for you all now? Okay, it looks like I am screen sharing. Okay, so here we are, NSVRC's website, and I'm going to move the grid so that you all can see that full and clear. And so you can see the URL is nsvrc.org. And right here, we have a big banner for Sexual Assault Awareness Month, because of course it's our main initiative right now. But just to give you a layout of our website overall, we have connections to all of our social media pages, which organization does a lot of outreach through social media, but it's also where you can find through our website a lot of the resources that we offer in terms of statistics, as well as our own publications and materials. And so NSVRC, we're providing resources on all aspects of sexual violence and sexual violence prevention. And Sexual Assault Awareness Month, although the acronym includes awareness, we really believe that it is the goal of raising awareness is working toward prevention, and to be educating our communities to understand the impact of this issue, and the role that they have to be involved in changing the culture and in creating change in our communities. So this year's Sexual Assault Awareness Month campaign has a theme specific to online spaces, because we know in the context of the pandemic, so much of our communication and lives and socializing and work and schooling have all now shifted to online contexts. And it's really it's for us increased our focus on wanting to make sure that we are promoting the skills of consent and respect and safety in those online spaces, because we know for so long it has been the norm in online environments that this is just that harassment it is really commonplace, and that this is that people are preyed upon in online settings. And so we're really hoping through this campaign to bring attention to these issues, as well as to start to move the dial on what is accepted and tolerated as a norm in online environments. So I'm going to explore the Sexual Assault Awareness Month website with you all more today, but just so that you know, on our website we also have a banner here that will take you to a resource page that is all on a variety of different subtopics related to COVID-19 response. And then we also have standing sections of our websites that are for survivors, for friends and family of survivors, for advocates and educators, and for the media and press. And then all of the tools and research that we offer are for those that are working in communities. We through our predominant stream of funding is rape prevention and education program through CDC. So a lot of our resources focus on sexual violence prevention specifically, but we do have a really vast array of resources and see education and awareness as a part of our prevention work. And we work with local programs as well as state coalitions and health departments all across the country, um, uh, as well as other disciplinary fields, whether they're nurses or law enforcement. We really have a very broad audience. We work a lot with college campuses, a lot of different, and even some businesses and corporations that are looking um, to understand more about this issue and address the impact that it's having in their environment and take steps to prevent sexual harassment and assault. So that's a little bit of a general overview of NSVRC. We create a lot of publications and materials. We have a very vast resource library. And I'll talk specifically now more about Sexual Assault Awareness Month. And to get to those resources, you just have to click on this banner here, and it takes you to our We Can Build Safe Online Spaces campaign website. And a few of the resources that I wanted to really highlight for you are in the About section and the Get Involved section. So the About section gives a great overview of the campaign. And I will just do a plug that this is also a unique year. So it's a unique year in that last year was our first fully virtual Sexual Assault Awareness Month. And for for many years, Sexual Assault Awareness Month has been a time when there is a lot of tabling events on college campuses or in communities, when there's a lot of like in-person activities, things like Take Back the Night events. And so to go fully virtual has really been a shift. And this year, in addition to that, is actually the 20th anniversary of the National Sexual Assault Awareness Month campaign. So the history of Sexual Assault Awareness Month goes back decades beyond that as like a grassroots campaign. But NSVRC has been providing resources and materials for 20 years now. And so at this About section, you can learn about the We Can Build campaign specifically, as well as some of the resources we have about online abuse and trauma. And the resources that we've gathered in this section are really trying to define what online sexual harassment and abuse are, because again, for so long, a lot of these experiences have been really taken for granted or kind of misunderstood in sort of the impact that they have had just because of their occurrence online versus in person. And there's been so much of a predominant focus on in-person harassment and assault. But what we know is actually most of the time there's a lot of overlapping dynamics, and that that it's not an either or scenario of someone who's experiencing abuse online or in person. That there's actually a lot of overlap and a lot of and a really significant relationship between abuse that happens online and abuse that happens in person. So this is just some really basic information about all of that and about creating trauma-informed online spaces. And then I'll go back to the About page. So this is also where you could see about more about the history of SAAM or past campaigns or tools like Sexual Assault Awareness Month press release. And it's awesome to hear that some of you all are from states and programs that are already utilizing these resources and putting out proclamations and press releases. In the Get Involved section, we have more information about events specifically, and we have a number of resources this year that are really about helping people to transition their events from in-person online, since that is such a learning curve. And so we have in this host events section a number of templated events that people can choose from: a SAAM 101 scavenger hunt, an online consent boundaries workshop, and a SAAM self-care section. And these are all so these are pretty much just like events where we give you all the instruction on sort of how you would all the steps to do to be able to host this event within your community, and then it allows you to publish that event in a national listing that hopefully makes it more easy and user friendly for people to be finding events in their community or on an issue that is important to them. So you can also find events online, and this our national event listing is through Mobilize. And as you can see, there's if you scroll through the list, there's dozens of events that are happening each day of April in communities across the country. So that is a little bit of a resource that I wanted to highlight for you all. We also have a 30 Days of SAAM Instagram challenge where each day of April there's a different prompt for people to be participating on Instagram. And then there are lots of fun prizes that people can win either based on their participation daily or throughout the month. And then we have a lot more materials for social media, especially in the context of how much engagement we know is shifting. Engagement and outreach is really shifting online. So instructions on hashtags to use, posts for different topics on different social media platforms. And this graphics page is where you'll find things like share graphics that are sized for different social media platforms, Twitter, Facebook, and Instagram, as well as things like Zoom backgrounds, Instagram story graphics, since that's, the use of stories is a really evolving platform on social media, as well as posters and GIFs. And the GIFs are fun because they're like, they're moving little graphics that that you can use on different all different social media, and they tend to have great engagement because of the fact that they are really eye-catching and have a little bit of movement to them. So that's all in our graphics section. And if you go back to the Get Involved page, one other resource that I really wanted to highlight for you all is about the Day of Action. So we have a lot of resources specifically each year for the Day of Action, which is every year. It's the first Tuesday in April. So that's tomorrow, April 6th, the Day of Action. And it's really just a day that we select as the Day of Action to be kind of an organizing prompt for people to participate in SAAM. And if they're planning events, to try and coordinate either events around that, or some people will then kick off their Sexual Assault Awareness Month campaign activities on the Day of Action because they're participating in other, observances like April is also Child Abuse Child Abuse Awareness Month. So it's just another way of giving people a specific day within April to highlight. And so we have a lot of ways that people can get involved, as well as a specific call to action to wear teal on the same Day of Action. So if you have not planned out your outfit yet for tomorrow and you want to wear some teal, that can be a great way to get involved. And we would definitely welcome you to post a selfie using the SAAM 2021 hashtag. Yes, and so we have a lot more resources. I'll just give you a cursory. There's a whole section on prevention resources that includes how we can create online communities that are safer. So this is pretty high level information for settings like for schools or workplaces to be thinking about in terms of the online community that they are building. We have a section on keeping kids safe online, as well as digital consent, boundaries, and everyday consent online. And then we also have a section with survivor resources that has information for survivors on finding support online, and a number of different blogs that we will be posting throughout the month that highlight different themes related to the topic of online harassment. So this is our first blog for our this year's guest blog series, and it's in accordance with Jennifer Hirsch and Seamus Khan, who are authors of the book Sexual Citizens, and they are talking about offline strategies to build sexual citizenship online. And so the big prompt that I'll have for you all there is just to stay tuned to NSVRC. If you're a social media user, you can follow us on social media. That's where we'll be sharing our activities and resources throughout the month. But you can also, on our website, subscribe to our mailing list, where we will also be sharing those resources by email. And so that is just a bit of an overview of our Sexual Assault Awareness Month materials. And from here, I'll pass it on to Karen to jump in to give you the overview that she was planning from the perspective of someone who's very involved in Pennsylvania's STOP efforts.
Thanks. And as you're transitioning, Karen, I also want to thank you, Laura, very much for that overview. There's a lot there. We could probably spend the whole hour just exploring. There's so many good things there. And as Karen is talking, I'd also like all of you as STOP administrators to be thinking about how you can use these resources in your STOP planning efforts, in your outreach to subgrantees, and all the things that you're doing, which I know that Karen is going to speak from Pennsylvania's perspective. So thank you very much, Karen. And then we can have a discussion after your presentation.
All right. Thank you, Robin. Thank you, Laura, for teeing up. My name is Karen Galbraith. I'm the Training Projects Coordinator at PCAR, as Robin already introduced. My background, my entire career has been focused on working within the field of sexual violence, and I worked initially in a local rape crisis program. And if I'm recalling correctly, because it's been some time, I do believe I was STOP funded at that time too. I now have worked at the Pennsylvania Coalition Against Rape for going on, gosh, it might be 7 years now, where I'm also STOP funded. And so I'm really excited to be having this conversation today, because I think so often our STOP work is very much focused on sort of all of us who work to respond to incidences of sexual violence, focuses a lot on, first responder type folks. And so I think it's such a great opportunity, and SAAM provides us with a great opportunity to really think about the prevention side of things, and to think about how our work is, we need each other. And I think so often we silo that work, that prevention and that response work. And I think SAAM gives us a chance and an opportunity to really integrate those two sides, and to use our STOP programs and our STOP teams and all the different folks that are working under STOP to think about how important our role is in the prevention of sexual violence. And so just thinking about how we can utilize all the wonderful tools that Laura just was talking about to raise awareness in our communities, because we know that a strong response and strong awareness in our communities has a preventive effect. And that's ultimately our goal, right, is to have safer communities. And so at least in Pennsylvania, STOP funds are used in a variety of different ways to support survivors and hold offenders accountable, not only in our counties and our towns, but also within college campuses and within schools and community groups and within our own agencies and organizations. And so, I just really encourage all of you to do some more exploration of the NSVRC website and to check out those SAAM tools at your leisure, and really think about how you can integrate the information about safe online spaces and consent and creating healthy boundaries within, your workplaces, and then certainly sharing that with the other folks in your states that are working in STOP, and thinking about how they can be integrating it into, the work that they're doing, so that we're not only making sure that we're taking good care of ourselves and our colleagues, but also spreading that word throughout our states and our communities. So one of the things I like to think about with SAAM in Pennsylvania, my understanding is we have, and I'm not an expert on STOP in other states, but we have sort of a unique setup, and I credit our Commonwealth style of government here that has create some really cool opportunities, but also, of course, some challenges, and having, lots of cooks in the kitchen, because we have 67 counties in Pennsylvania who all do things in very different kinds of ways. And so with STOP, how our funding works is the funding passes through the Pennsylvania Commission on Crime and Delinquency, and then is distributed not only to state level organizations such as the Pennsylvania Coalition Against Rape, the Pennsylvania Coalition Against Domestic Violence, the Pennsylvania Chiefs of Police Association, the DA's Association, but it also gets passed down to those counties. And so not every county receives STOP funding, but different counties are able to apply for that funding and then use it in ways that are most appropriate and most needed in their communities. So as you can imagine, a response or how those funds might be used in a county like Philadelphia County is going to be very, very different than what we see in our very rural counties within Pennsylvania. But what happens in all of those counties that are STOP funded is that they do create response teams, and they're working together to develop protocols. And so one of the things that I have really done in my work to support teams is really around that team building and relationship building, and really creating that strong team dynamic so that the relationships are formed and built, so that when they are, needing to respond to a report of sexual violence, that they are prepared to do that, and that they have the relationships in place and the processes in place to do that most efficiently and effectively. And so I think so many of the SAAM activities are great opportunities to engage in that team building, to sort of do some of that work that can, not just raise awareness in communities, not just get all of those team players out interacting within communities, but also just with each other, so that, some of those professional walls are broken down, so that we can sort of do away with some of the siloing that happens between disciplines. So it really can help to build those partnerships and build collaborations. When we're able to focus on creating these awareness events, many of which are really a lot of fun to create and engage in together. So also, as Laura was pointing out, I just really want to highlight some of the resources around self-care. I know in Pennsylvania, and I think nationally, we are really spending a lot more time talking about the impact of doing this work on, the professionals in the field. So on victim advocates, on law enforcement, on prosecutors. And there are some wonderful self-care resources within the SAAM site that Laura introduced you all to, but also elsewhere on the NSVRC website. And so, introducing our STOP teams and our STOP grantees to those resources, I think, can be really, really beneficial. There are obviously a lot of resources on there around self-care for survivors, and, always important to remember and to note that we have a lot of survivor leadership within our field. And so we want to be supporting, the survivors that are doing the work, but then also everyone who's doing the work, because we know that it can take a toll. So there's some great resources in there around self-care. And so again, I think these materials really and resources really provide an opportunity for us to think about different ways to be doing our work, new information that we can be sharing in our communities. I also really wanted to just put a plug in. Also on the NSVRC website is the SART toolkit, which is the Sexual Assault Response Team Toolkit, which is a phenomenal resource, and one of the resources that I send out to folks most commonly, because it's just the A to Z of best practices for sexual assault response teams. And there's great information in there about protocol development, what should be included. There are great resources as far as, that could be used for like educating SART teams around issues related to trauma, the most updated information that teams could be needing. And again, it could just be utilized by people from those different disciplines. But of course, we always love to highlight that multidisciplinary approach. So I just want to sort of wrap up my spiel there, because I want to make sure that we have plenty of time for people to ask questions or brainstorm ideas together about how these materials can be utilized. Or if you have other questions related to sexual assault prevention or response, we're happy to answer those.
Thank you, Karen. And thank you for drawing some kind of straight lines, connecting the dots between the STOP program and awareness activities. So, and also Laura, thank you for putting the SART toolkit up too, because that's something that I think everyone, there's a direct program purpose area related to teams to SART. And it would be great for folks to just kind of get a refresh on that, and also know that some of their subgrantees could really benefit from that. One question that, let me just open the field. I've got a few questions, but let me open the field to all of you who just heard the presentations and are thinking about this. Do you have anything you'd like to ask our presenters? Well, maybe we'll start the conversation, and then I know this is not necessarily a shy group because you've been active in the past, so we can pick it up. But one of the things that I was thinking about as you were talking is the idea of survivor leadership. And one of the key parts about implementation planning for the STOP grant program is how you really have the voices of survivors at the table, and that you have a diversity of voices at the table, that you have programs that are not your traditional, maybe even just not even rape crisis programs, but rape crisis programs and others where there might be, say, a culturally specific program where you have incidences of sexual assault that are extremely relevant. I'm thinking about the Asian American community now. So what kind of thoughts do you have about how you make sure there is survivor leadership present, that there is awareness kind of in a broader sense of all the communities that our money, the STOP money, this program goes to?
Robin, is that for us specifically or for the whole
Yes,
group?
it's for you. Yes. Yeah, you're our experts today. So yes, please.
Oh, gosh, I feel a little shy just in that I don't think of myself as an expert so much in this field. I mean, I've done a lot of work in it, but I think it's absolutely essential to have survivor leadership at the fore, and absolutely essential to have those culturally specific organizations there. It's really interesting, and I feel like I'm just speaking from my experience here, not from any sort of expertise, but when I first got working in this field, at this point decades ago, there was absolute message sent that you kept your survivorship quiet. That was not something that you wanted to let people know because, people might not take you seriously, or it might be seen that you would be overly emotional about what you were advocating for. And that, and I know I'm not articulating this very well, but it was definitely something that people were sort of told to keep quiet, that you were not to lead with that. And so I think it's been really amazing and remarkable to see that self-advocacy happening, and to see it being valued, and to see that survivors are being recognized for their expertise and for their life experience, and that that is being encouraged from the highest levels, because I think that's been a shift, at least in my neck of the woods, at least in my experience. And so I think it's really, really exciting. I think we still have, somewhat of a ways to go. I think there's great strength in sex trafficking advocacy. I think they've really led with survivor leadership in a way that I think in the field of sexual violence is catching up to a degree. We're learning and catching up with that. But I do think that that's absolutely essential, and also essential that we are valuing people's expertise and compensating them appropriately and recognizing them appropriately, so that we are not sort of replicating some of those power and control dynamics, that we are valuing their experience to the same degree that we would value anybody else's expertise.
And I would ask too, if anybody on the call now, any of our STOP administrators in particular, or Mary, or anyone from also, if you have knowledge, experience of how survivors have been at the table in the STOP planning process. I'm thinking in particular about, maybe it's not they're at the table for the nitty gritty meetings, but maybe their expertise is sought in reacting to a plan, or reacting to a set of funding priorities. I mean, how are voices of survivors included in the planning process? Can I open it up? And I'm wondering, Emily, if you as a former advocate, or if anybody who is who's on the call can talk a little bit about how you've included voices of sexual assault survivors, DV survivors, or any other survivors in your planning process.
While folks are thinking, Robin, I'm just having a thought that I wanted to express, which is there are always survivors involved. It's just whether or not they are sharing that openly or leading with that. And so I think that's something else to always keep in mind, that, I do think that there are, I mean, I don't want to say always, but the vast majority of times there are going to be people who who are part of these processes that have experienced sexual violence or have experienced domestic violence, intimate partner violence, dating violence, stalking, and so, it's a different thing though, to have people there who are specifically invited and specifically tasked with providing that perspective.
Yeah. I think I'm thinking of two little stories. One is when we were on we had a governor's task force here in Florida many years ago. And the advocate who was on a local task force was actually an advocate who became a sworn deputy. She worked for the sheriff's department. And they asked her, what would you recommend if somebody was sexually assaulted, should they report? And you know what, as a survivor herself, and she actually gave this testimony, as a survivor herself and as someone who was an advocate and now a sworn deputy, she said, I'm not sure that I would. And when she said that, it really shocked. I remember the look on the face of the chair of the commission. It was so important to hear her voice and then hear her discuss why. And she had all of those hats. And as you're saying, it doesn't, someone's going to get a chance to disclose perhaps, or perhaps not, but they're, because of prevalence issues, right? We're looking at a lot of people who are survivors. I'm thinking too, about the Larry Nassar case and really the voices of victims at that trial, where the judge said you were going to sit there and hear every single one of the testimonies of these victims, survivors, that you did this to. And that action by a judge. So when we think about STOP that funds courts and prosecutors and law enforcement, I couldn't agree with you more that there's been such a sea change in how survivors' voices are being heard, and legitimated in society like never before. I really they're just the stories we can go on and on. Is there any other comments that you have? Laura, would you like to add anything to our discussion?
So in terms of this, just thinking about how we engage and involve survivors, I think just to echo what you and Karen have shared, I think that there's been, there's been a lot of progress in the field, and given this progress and given what we know about the prevalence of sexual violence, of sexual harassment and sexual assault, of domestic violence, of stalking, it really, it seems like it seems really important for us to normalize survivorship and to not necessarily go into conversations from the assumption that the only quote unquote survivor here is the person that we've given that hat to or invited to join the table for that role, but to actually operate from the assumption that, statistically, you always have a great likelihood of interacting with a survivor, or that someone is bringing bringing their direct experience to the conversation. And so I think that the more we can really normalize that as practitioners is so important in terms of fully continuing this evolution of it not being something that individuals feel like they have to hide or that they have to be ashamed of in their experience, and then also to move past this duality of someone's role in a space is to only be a survivor, when we know people are coming to the table with so many hats on. And then the other piece of it that I would just say from NSVRC's perspective and experience is that we actually, as a national organization, hear from a lot of survivors that are interested in sharing their story and interested in plugging into our movement. And we also hear from a lot of journalists that are looking to uplift the stories of survivors. And what can be difficult is NSVRC we're not in a good position to directly connect survivors with journalists, unless it's a journalist that we have have developed a very significant relationship with, and we sort of know the context that they're reporting and the community they're reporting in. At the national level, we're really not in a position to facilitate those relationships and ensuring that it's not going to be something that is, that could potentially cause harm to a survivor. But what we, I think, oftentimes find is that it can be difficult for survivors to know where to plug in. So say they didn't necessarily, if they never like formally accessed resources through their local rape crisis center, oftentimes it's a process of us introducing them to the state level resources that are available to them, introducing them to the community level resources that are available to them. And I think that that's an opportunity that doesn't necessarily always fit into the job description of, or maybe the perceived job description of everyone who's working in these settings, is how they can work to facilitate those connections with survivors. Or what do you do when when there's a survivor who's reaching out in this way and wants to be involved? So I think that it's just in terms of like from the national perspective, it seems like there would be a great value for like states and local communities to really think about what their plan is for if they want to be doing outreach to survivors, or if they want to be doing relationship building with survivors. How are they going to facilitate those relationships? And there's a number of really great resources that are out there. That things like we still heavily reference the National Domestic Violence Resource Centers. They have a guide for survivors in terms of like preparing to speak publicly about their story, and it is really comprehensive in terms of like talking about all of the potential considerations that are important for a survivor in terms of privacy and potential legal concerns. But there's a lot of resources out there that can help equip survivors to be doing this in a very informed way. And I think that the other piece of that is to recognize that because of how much our society has moved to online communication and through social media, there's a lot of survivors that are actually quite public with their story already through social media and haven't necessarily held back the details it's sort of in the ways that like we even as advocates might guide them to. So I think that piece of it is another opportunity for communities to both be relationship building with survivors, but also offering resources for their support.
Exactly. Well, those are great resources and ideas. And I'm thinking of a few different ways that STOP funds could be used. And Mary, thank you for posting the note here that STOP funds for prevention is a possibility for sexual assault, sexual violence cases. Up to 5% of the total STOP award can be used for developing, enhancing, strengthening prevention and educational programming to address the DVSV, dating violence and stalking. So know that you're doing that. Can I ask all of you who are on the phone from various states, are you using any of your STOP funds now to do any prevention work? And or could you answer, what do you think about what you've learned today? How are you going to use any of the social media graphics, the information, talking about the NSVRC's website information with your subgrantees or your colleagues? Can anyone offer some ideas about how you've maybe found this information useful today? Are you already doing anything on Sexual Assault Awareness Month? Bill says he funds both coalitions to do statewide prevention work, right? So you've got a funding, under STOP. Bill, I'm guessing you're doing that under STOP? Right, okay. And Mary notes too that prevention, don't forget, includes both primary and secondary prevention. Mary, would you like to speak to any of those issues around prevention? Because for the longest time, it was completely forbidden to even be thinking about prevention under STOP. And then the door opened, I don't know, a decade ago or so.
Yeah, so in 2013, as part of the 2013 VAWA reauthorization, prevention was added finally. So it's not a huge part of your award, of course, but I mean, you can do something like what Bill has done in New York and provide your coalitions with funds to do that sort of work. it can enhance what they may be funded to do with another funding stream. Yeah, that's so that's language directly from the CFR, and then the FAQs, the very famous STOP FAQs, they also speak a little bit to that as well. Yeah, but I'm sure that Laura and Karen have lots and lots of ideas on their respective websites about what you can do with just a little bit of money to raise awareness.
Exactly. Did you have anything you wanted to add to that, Karen? Maybe things you've seen around Pennsylvania that are worth noting?
Well, I think, you know, we've seen lots of our STOP teams and organizations, you know, participate in a lot of the different types of activities that Laura was mentioning. We have them, a lot of them do, you know, proclamations. A lot of them do the activities where they have people, you know, sign up about different ways that they're going to prevent sexual violence or support survivors, you know, big, you know, poster boards or banners that they create. Lots of people that have denim days where, you know, people wear jeans and donate money to different causes. And certainly the wearing teal events where people are, you know, taking pictures and posting to social media and other sort of community involvement type events like that. Now, whether programs are specifically using STOP funding for those things, I'm not sure, but certainly I know that those groups of people are working together to do these types of events.
Great, great. And Laura, you've noted that you don't use any funding, STOP funds for prevention unless subgrantees are doing some of their own, and they don't fund coalitions to do the work either. Now, Laura, if I could ask you, is that sort of just because of not enough funding and there's so many other needs, or someone else is doing it? Or do you feel comfortable talking about your process on that?
Yes, we don't directly fund the coalitions at all. I know VOCA does both. I know the NAV gets direct funding from VOCA, and I'm not sure about the Coalition Against Domestic Violence and Sexual Assault. And I know some of our subgrantees do some prevention efforts. But again, it's a very small percentage of what they do. They do a lot more in the outreach category.
And really this idea, I'm looking at what Mary had there before, you know, any work that you can do to develop or enhance or strengthen any of these things, prevention, educational programming, et cetera, that would definitely include awareness, and certainly all of these SAAM activities. And I like in particular, Laura, that you've, you know, that you have a focus on online. I think that how can we not focus online now that we're looking at it, or we have looked at a year of COVID, but that there's so much more that we need to learn about vulnerability of people online. You know, certainly we know, and Karen, you alluded to how sex traffickers have really had a field day online with both children and adults, recruiting, intimidating, sextortion. All this is digitally driven. And safety online, and you know, that's where you just think about primary and secondary prevention and an absolute direct law enforcement activities too. Any of the law enforcement units I've ever seen talk about sex trafficking, they've always had to talk about online vulnerabilities, right? So Bill, you note that you chose the coalitions for continuity of messaging and to ensure that all programs can benefit from the work, even if they don't receive a direct STOP award. Exactly. And that the coalitions have a whole range of resources, kind of a continuum of resources that can be available, which prevention is an essential part of it. And I've always found it to be quite difficult to sometimes draw the line when you're, you know, just intervention, prevention, and actually working sometimes to say a survivor's family or children. You know, you are doing work with that survivor, you're doing intervention, and you're doing prevention work as well. Okay. Any other thoughts or observations from you all at the STOP grant level, the STOP grant state administrator levels, and what you've been doing? Any questions you might have, or any ideas how you might be doing, or what your state's doing around SAAM this April? Okay. Mary, any additional thoughts you might have about the topic, or anything you'd like to add? These are all terrific, amazing resources. So I know it's great to be sharing them with you all today. Any other thoughts?
Yeah, I mean, this is a good time to start thinking about how you can incorporate sexual violence, your 20% set aside into your funding strategy as you're developing your plans. We're hoping that, of course, you go beyond 20%, and that makes up a greater portion of your total STOP award. And talking to your coalition, including a tribal coalition, if there's one in your state, or serving the tribes in your state, that's a really, really important source of information about sexual assault of Indigenous women too. So, and please feel free to reach out to us to talk further about this. We're happy to help on a one-on-one basis.
Great, thank you. Any other questions? We do have 4 minutes left. I feel like I always want to get every single second in with y'all, but anybody having any other thoughts, concerns, questions about STOP, the STOP grant process, your implementation planning, your VAWA STOP team, your gathering of data? And also, let me just throw out there, for the good of the order, we're in the process of always looking for special topic areas that you all might benefit from. So if there's anything that you're interested in hearing more about, we did firearms last month, had quite a great discussion about that. Anybody having any little road bumps in your STOP planning process that you want to raise or get some further information about? Okay. Well, I guess that then will wrap us up. Let me do another little commercial, like we always do, for the next STOP TA clinic, which is going to be on April 19th. We're going to continue our discussion around sexual assault issues for this month. We're going to have 2 speakers who are going to talk about sexual assault, specifically kind of nitty gritty when it comes to how it is integrated into your STOP planning process, how the implementation plan in terms of all your sections, whether it be data, prioritization, will be utilized. The 2 speakers from the Resource Sharing Project will highlight additional new plans and information that they have. That includes new programs, as well as ideas about how you can make sure that you are really dealing with this issue of sexual assault, as Mary said, not just in the 20% mandate, but that you're dealing with it fully, and you're able to attract people to apply for funding who have never applied for funding, and really carry out a more complete, comprehensive program with these STOP dollars. So we're looking forward to that. And Mary and Courtney and Marisol, do you have anything you would like to add?
Not at the moment, no, but thank you to Karen and Laura. This was a very good presentation. I was just glad to be here with all of you.
Absolutely. And I hope, and Mary, do you have anything you want to add?
Oh, just lots of good tools. I really encourage you to check out the NSVRC website. There's just some really, really good things. They make it really easy for you to provide information about SAAM this year. And so, yeah, just I would say check it out.
Okay, great. And on a really kind of cool note here, Bill, I just saw this, that you're working with your state office to turn your state teal with teal lights on public buildings. That's awesome. Absolutely. And thank you all for this. And And they're always great ideas. I love innovations in communities, and certainly that's one that's tried and true. And I hope you have success, that you get that done. So excellent. All right, everybody. Well, we'll see you on the 19th. Thank you again for your attendance today. Really love to hear from you, and whether it's in the chat or whether it's kind of your live voices, it's always great to be with you. So thanks, y'all. And thank you, Bill, for your kind words. All right, everybody. Take care.
Thank you.
Bye-bye.